Welcome to More Than Medicine, the podcast from Zeam Health. This show explores how integrated psychiatry, primary care, and aesthetics come together to support the whole person, not just isolated symptoms. Each episode is grounded in clinical insight, real-world care, and the latest research, helping you better understand your health and the options available to you. Whether you're navigating mental health, managing a chronic condition, or thinking about preventive or aesthetic care, this is where medicine connects. Let's get started.
CBT versus psychodynamic therapy. How clinicians decide what's right for you. At some point, a lot of people ask the same question. What kind of therapy actually fits what I'm going through? On paper, it sounds simple. In real life, it can feel confusing. There are many approaches, and two of the most established are cognitive behavioral therapy, CBT, and psychodynamic therapy. They look at the same human struggles, but from different angles. Almost like using two different maps of the same territory. And here's something important to keep in mind. The American Psychiatric Association estimates that about 75% of people benefit from therapy. So the real question usually isn't, does therapy work? It's, which approach fits me? Let's break down how these two models differ, how clinicians use them, and what actually matters in real-world treatment. Cognitive behavioral therapy, CBT. Many clinicians start with CBT because it stays close to the present moment. CBT is built on a simple, practical idea. Thoughts, emotions, and behaviors influence each other. If you can notice distorted thinking and shift unhelpful habits, emotional relief often follows. The APA describes CBT as learning to recognize patterns and practice new responses, so it tends to feel concrete rather than abstract. A typical CBT session has structure. Setting goals, talking through recent situations, learning a specific skill, and testing that skill between appointments. CBT is usually short to medium length and focused on measurable progress. That structure also fits the way care is delivered today, especially through telehealth. In fact, the 2024 National Survey on Drug Use and Health found that 12.8% of U.S. adults received mental health treatment through telehealth. And among adults with major depression, that jumped to 42.4%. So, a model that works well over video makes a real difference for access. And when researchers compare CBT to psychodynamic therapy for depression, the results are strikingly similar. In a 2024 review of 9 randomized trials, people improved almost the same amount in both approaches. The difference was so small, it didn't look meaningful in real life. The takeaway? Instead of hunting for a better method, it often makes more sense to choose the style that fits your goals and preferences. Psychodynamic therapy. Psychodynamic therapy takes a different route and usually moves at a different pace. Rather than starting with today's thoughts and behaviors, it looks at how past experiences shape the present, how unconscious patterns repeat, and how early relationships influence adult life. This approach assumes that unresolved conflicts and relational templates echo across adulthood. They show up in emotions, in relationships, and even in how someone relates to the therapist. Sessions tend to be more open-ended. Instead of an agenda, the conversation follows what feels most alive that day. The goal isn't only symptom relief, it's deeper understanding and lasting change in long-standing patterns. And psychodynamic work doesn't have to be endless. A 2025 trial compared short-term psychodynamic therapy with CBT for depression, 16 sessions over 8 weeks, and both groups improved equally. That's encouraging for people who want insight-focused work but need a time-limited option. A simple way to compare them. Think of the differences like this. CDT: focus, present, and future. Therapist role: coach, building skills. Style: structured and plan-based. Goal: symptom relief through practical tools. Length: short to medium. Psychodynamic: focus, past and present. Therapist role: interpreter, exploring meaning. Style: open and exploratory. Goal: insight into patterns. Length: medium to long. Neither is stronger. They just feel different. How clinicians actually decide. In practice, clinicians don't start by asking which model is superior. They ask, what does this person want to change? How do they learn best? What patterns are showing up right now? What fits their schedule, coverage, and comfort level? If someone wants clear steps and skills for panic, obsessive worry, or avoidance, CBT often makes sense. If someone feels stuck in repeating relationship patterns or wants to understand why the same emotional story keeps playing out, psychodynamic therapy may fit better. And many clinicians blend both approaches, because real people rarely fit neatly into one box. Your therapy journey is personal. Both models offer real, evidence-based paths forward. CBT gives tools you can use right away. Psychodynamic work helps you understand the deeper why. Since outcomes often look similar on average, the most important factor becomes fit. Your goals, your personality, and what feels meaningful to you. At Zeam, we listen to your story first. We draw from multiple modalities, including CBT and psychodynamic approaches, to build a plan that feels realistic and human. If you want to explore which direction fits you, reach out to our team and start the conversation. Next episode, we'll tackle another question many people struggle with: psychiatry versus primary care, when mental health needs a specialist. We'll talk about where most mental health care actually begins, how to know when to escalate to psychiatry, and how primary care and psychiatric specialists can work together. Thanks for listening, and we'll see you next time.
Thanks for listening to More Than Medicine. If today's episode sparked questions about your own health or helped you understand your options more clearly, you're not alone. At Zeam Health, we provide integrated psychiatry, primary care, and aesthetic services designed to support your long-term well-being. To learn more or schedule a visit, head to zeamhealth.com. We'll be back soon with another conversation focused on care that goes beyond the surface.